Hey, what's up, guys? It's Dave. Today we're going to go through some frequently asked questions and information about COVID-19 for EMS responders. This is really intended for EMS providers, not the, if you're just a general member of the public, you're more than welcome to watch this. But some of the recommendations for you are actually a little bit different from the CDC. So while you're welcome to watch, just keep in mind that some of the answers to these questions are different depending on what you do and your availability of protective equipment and medical training. So if you're a member of the public, I actually recommend that you go check out the health department or the CDC's website, and that's going to give you some specific guidelines for you. Also, if you are watching this, it is probably updated and changed. So this stuff changes regularly. I do highly recommend that you go to the more current version of this document to check it out. It's bit.ly/COVIDEMS, and that's going to jump you right over to the current version of this document. Just scroll down to the last page, and that's where we're at with the frequently asked questions. So all of these are written out. I am going to expand on some of them, but at the same time, if you are someone who does better just reading and learning on your own, you can skip this video, but hopefully we will answer some of these commonly asked questions and give you some clarification on some of them as well. All right, so first off, what is this document? What the heck is this thing that we are talking about? This is compiled of the current CDC guidelines and recommendations for EMS responders. So this is, again, not really geared towards anyone other than EMS responders. So if you're confused and you're not sure where to go, if you ride on the ambulance and take care of patients, this is for you. If not, then there's better resources that are directed more towards you. This is a document that gets updated really every day. We've got several medical directors, doctors, people that look over the recommendations as they come out and pick and choose the bits of that really apply to EMS and put it in this document. So this thing is updated just about every day. So definitely come back and check it out. We don't necessarily re-record a video every day, but go to the link and go to that bottom page, and that's where you're going to find that. All right, is this the most current information? Yes-ish. So this is the most current validated and fact-checked information that's put out by the CDC and the Department of Health or World Health Organization. And, it's the stuff that gets validated. There are going to be things that you're going to see on the internet, things you read on Facebook that might be emerging or coming out. Some of them might be true, but if they aren't backed up by proven references that we can go back and cite and look at, they're not going to be in this document. So don't feel like, hey, I saw this new thing that my buddy shared on Facebook. Why is it not in this document yet? If the CDC hasn't come out with it as the official recommendation for EMS providers, it's not going to make it in this document. So that's where it goes. That should hopefully give you a little bit of comfort in knowing that the stuff in here is valid. But at the same time, while you should trust what I'm saying, and when I say that, you should also check it and validate it yourself. So everything in this is backed up, and at the very bottom of this, I'm going to show you all of the references and links that are used to support the information in this document. All right, and I highly recommend you check that yourself. All right, so don't take my word for it. Don't take our medical director's word for it. Check it and validate yourself. Just make sure that you know what sources you're getting that from, that they're trusted. All right, so the next question on here, now we kind of actually get into the substance of this itself, is what counts as a fever? So there's kind of two answers for this one if we're talking about for providers and when you should or shouldn't be working. If you are able to check your temperature, the current cutoff is 100 degrees Fahrenheit. So if you have a temperature over 100, then you should not be working for at least 24 hours. And that does include medication free. So if you've taken a Tylenol or something to reduce your fever and your fever came down, that's not what starts that 24-hour time. So you got to be without medicine and without fever for 24 hours. But also, if you just feel like you've had a fever, or if the patient says they feel like they had a fever, even if you couldn't check and confirm what the temperature was, that's okay. That still counts. That counts as a fever as far as this document goes. All right, what counts as a cough? This is something that actually has caused a lot of questions in our agency. So it's kind of, this is hit at a bad time because it's allergy season. The it's warm out, so there's a lot of pollen. A lot of people have a cough. So what counts as a cough? So it's defined as a sudden increase in the cough strength, frequency, and or production, kind of like they have the flu or a cold. That counts as a cough. So an isolated, chronic, or occasional clearing of the throat, like seasonal allergies, that's really not concerning. That's not what we're talking about when we say cough. All right. Next question: do I really need a mask? Yes, you absolutely need a mask. This is really the absolute minimum. You should have a mask really no matter what. If you're going to come within 6 to 8 feet of a person that has potential of having COVID, you definitely want to be wearing a mask. So make sure that the patient gets a mask too. They need a mask. You need a mask. Everybody gets a mask. Put some kind of mask on. Usually just a regular surgical mask is going to be okay for EMS providers unless you are in a real high-risk situation or you're doing something that's going to put that at higher risk, like a nebulizer or BVM or CPAP or something like that. And actually, I kind of gave away a little bit in the next one, but that's all right. We'll still go through it. So the next question is it mandatory to wear a fitted N95, goggles, and a gown? So all of that PPE. The answer to that is, yeah, kind of. It really depends on the situation and the availability of resources, but in general, the CDC does suggest that if available, you use all of these things. Now, a simple surgical mask is appropriate if an N95 is not available or if you're not fit tested for that mask. And if they are really scarce and your agency does not have many of those, typically they're recommending that you hold on to them for those more high risk situations, like I mentioned. So a patient that's needing to be bagged or use CPAP or a nebulizer or something like that. A lot of places are going away from some of those procedures anyway, but if it's something that's critical for that patient, then definitely you want to make sure you have the highest level of protection that you can. And talking about that N95 too, that's really just for the provider. So if you do have N95s, the patient doesn't need an N95 mask. For one, they're not going to have been fit tested for that, so you don't know that you're giving them the right mask or the right size. So just a simple surgical mask is good for the patient. All right, next up, will hand washing really help? Actually, hang on. Before I jump to that, I kind of missed the last sentence on this previous one. So goggles are also really important. Make sure you have eye protection. Goggles are very important. That's going to really reduce your risk. And goggles are easy because that's something that we can decon. We can, wipe down with an improved cleaner, let it air dry, and we can reuse those if we have to. So those are pretty accessible, and there's really no reason why you shouldn't be using some kind of eye protection that's approved. All right, sorry, jumping on to the next one. Will hand washing really help? Yes, that's probably the number one thing on here. So masks, yes, you need to be wearing those, but regardless of whether or not you think you've had contact with a COVID patient, hand washing is critical. You want to be washing your hands all the time. Anytime you're touching surfaces and driving, touching doorknobs, anything like that, you really need to be washing your hands a lot. Soap and water, at least 20 seconds. Wash your hands well. If you don't have access to soap and water, you can use hand sanitizer, but ultimately we still want to use soap and water to wash our hands as soon as we can. So hand washing, very important. All right, next up, should I get tested for COVID? Generally, no, actually. This may kind of seem weird or surprising to you, but for the most part, as responders, we don't need to get tested for COVID because it's not going to change anything in what we do or our treatment. There's kind of one exception to that I'll hit on in a second. But for the most part, no. Just like the general public, most cases we don't really need to test because it's not going to change anything with our treatment or our precautions or what we do. So Where testing comes in for first responders, there's really two important pieces here. One is that we want to test the source patient. So if we have a potential exposure that's medium or high risk, we really want to test that source, that person that was sick, because that's going to mean the difference between whether we have to sit out for 14 days or when we get that negative result from them, then we can get right back to work and get back to helping other people in the community. So getting tested is important, but not because we're special or that we need it. We actually are trying to test that source patient, but it's just to get us back in the fight, get us back in the game so we can go back and help more people. So that's kind of A with testing. The other side to that is if we have an exposure or a potential exposure, even if that person is positive, we can test our provider a few days later. So right now they're looking at about 3 days after a potential exposure is when most people start to actually shed that virus or become infectious. We can do some testing on the provider then to figure out if they actually have it or not. And again, we can use that to help determine how long they need to be out for. So if you hear about first responders or medical providers getting tested, it's just because that's going to determine whether or not they have to stay isolated and not go to work and help the community, or get on the ambulance or get to the hospital and take care of patients. That's going to really dictate how long they are out of service to go back to helping. So that's really where the tests come into play. All right, next question is my uniform contaminated? So generally, no, your uniform should not be considered contaminated. Obviously, if you are not wearing a gown and somebody coughs or gets fluids on your uniform, then yeah, you might want to take that off and, shower and change clothes. But that's not just for COVID-19. Like anytime you would get nasty stuff, blood, body fluids on you from a patient, you would want to take care of that. So that's not really COVID-19 specific, that's just in general. It is important, however, that you wipe down any hard surfaces. So depending on the kind of uniform you wear, if you're wearing your pager or a radio or a badge or anything like that, that stuff should be decontaminated, just wiped down with an approved cleaner. So hard surfaces, yes, but otherwise you should be good. And then, yeah, if you did get any obvious contamination and body fluids on there, then you want to get that laundered and cleaned, and you should probably shower too if it's bad enough. But a gown will protect you from most of that stuff too. So if you were able to wear a gown, then that should cut down on the need for that. All right, next question, is my truck contaminated? No, I mean, you need to decon it, but that doesn't mean that your vehicle has to come out of service. So if you have an ambulance and you have a potential patient, then basically what the CD recommends is allowing clean air to circulate through that ambulance and also wiping down all hard surfaces with an approved cleaner. So how that looks for EMS is basically when we get to the hospital, we are going to offload our patient. Normally, we would have closed all the doors, shut everything, and kind of gone in. Now we don't want to do that. We want to leave all the doors open, let that air circulate. That's going to clear out any of the virus that's in the ambient air, and then that's also going to help take care of anything in fabrics. And when we come back after we've turned our patient care over and done everything that we need to do to decon ourselves and our equipment inside, like our stretcher, when we come out, then we're going to need to decon the truck, and that's just going to be wiping down all hard surfaces with an approved cleaner. Depending on the decon and what you're doing, they do recommend that you use the appropriate protective equipment. So that could include gloves, gown, goggles, all that, to make sure that you're protected when you're deconning the truck as necessary and appropriate. All right, the next question on here, is my family at risk? No, I mean, your family is not at any greater risk than any other time. As long as you're using the appropriate precautions and sanitation and everything else, then your family is not found to be at any specific high risk compared to others. So the CDC does not recommend any special management of people exposed to asymptomatic people. So if you are on quarantine or isolation but you're not sick, then other people that you interact with are not at any in particularly higher risk. Again, as long as you're following the standard precautions and things with that. So, and then the last question on here, where can I find more help? What counts as high versus medium risk? When can I come back to? Okay, all this stuff. Yeah. So everything else, if it's not covered under here or you're not comfortable with it or not sure, you should reach out to your agency's infection control person, whoever that happens to be, and they can help walk you through that. And they may have to reach out or phone a friend, get a hold of others, but they can get answers for you. So definitely reach out to them if needed. And then finally, here are the references. So if you need to back up any of the things that I just said or any of the things that our medical directors included in this document or the updates, here are the sources and the dates that they were released. This document was created and is regularly updated by Dr. Iki, LaPera, and Stanley, who are all medical directors of Blacksburg Rescue and several other agencies. And so while we're talking about this and going through this for educational purposes for our providers, if you're going to use any of this for anything else, just make sure that you check with them or follow that link at the bottom to cover all of the details as far as copyright and fair use. So check that out, and if you have any questions, feel free to reach out to us. Keep in mind these documents update regularly, so at the time you're watching this, some of this stuff may have become outdated, and I highly recommend that you source all of this stuff. Check to make sure that it is current, and you can check back to this document. Again, that is, here are the resources for you. So this EMS guide, if you're on the EMS side of things, it's bit.ly/COVID-EMS, and for the law enforcement and fire folks, it's bit.ly/COVID-911, or you can scan either of those QR codes. Thanks. I hope you found this informational and got something out of it. And if you have any questions, reach out. I do recommend, if you want to stay up to date as we post updates to this stuff, feel free to subscribe or follow this channel. That way you can get notifications whenever we post any updates. Thanks. All right, guys, thanks for watching. If you click subscribe, you'll get a notification every time we upload a new video with this topic. Also, make sure you check those links because this information does change rapidly. So check the links, you'll get the most current info. And if you have any questions, leave them down in the comments and I'll try and get back to you with an answer as soon as I can. Thanks.